Preoperative and postoperative hip exercises. The following exercises are to be performed preoperatively in preparation for your total joint replacement. The same set of exercises are to be performed postoperatively to maximize your potential and improve your outcomes. Some discomfort is to be expected. If pain increases significantly, stop the exercise. All exercises should be done as tolerated to increase strength. Overdoing exercises may seem like progress while you are doing them, but the next day you may find you have an increase in pain, swelling, stiffness, and soreness. To perform your hip exercises, you will need a pillowcase or plastic bag. My name is Heather Goatee. I'm a physical therapist at our Taylor Station Total Joint Therapy Clinic. This is Sarah Hennessy. She's a physical therapist assistant at our Sawmill Total Joint Therapy Clinic, and Sarah is going to be demonstrating some exercises for us today. The first three exercises are to help promote blood circulation and reduce the risk of blood clot formation. These are to be performed 10 times every hour that you are awake. The first exercise is called an ankle pump. Sarah, you're going to move your feet up and down from the ankle, just like that. And the next exercise is called a quad set. You're going to tighten your thigh muscle. You're going to push the back of your knee down towards the bed. Try to push my hand. And hold for 5 seconds. And relax. Good. And the final exercise is called a glute set. You're going to tighten your buttock muscles. Hold for 5 seconds. And relax. And again, we're asking that you perform 10 repetitions of each of these exercises for every hour that you're awake. The following exercises are intended to improve muscle strength and should be performed 1 to 2 times per day, beginning with 5 to 10 repetitions and increasing to 20 to 25 repetitions as tolerated or as instructed by your physician or therapist. You're going to bend your knees, Sarah. The first exercise is called a bridge. You're going to tighten your buttock muscles and lift your hips up towards the ceiling. Hold for 2 seconds and relax it down. The next exercise is a march. You're going to take your operative knee and you're going to pick it up off the table as though you were marching. Now for the next two exercises, it can be helpful to place a pillowcase under the foot to help the leg slide more comfortably. This exercise is called the snow angel. Sarah, you're going to slide your foot outwards towards me and then back to the center. And next, we're going to do a heel slide. I want you to bend your knee and slide your heel towards your rear end and slide back down. For the next exercise, you will sit on the edge of the bed or in a chair. You'll extend your operative leg out in front of you and lower it down slowly. The following exercise is a chair push-up. You'll begin seated in the chair with your arms on the armrests. You're going to push up, straighten your arms, and lift your rear end up out of the seat. The next three exercises will be done holding onto the kitchen counter or the back of the couch for support. You'll stand on one leg and kick your opposite leg out to the side. And repeat on the other leg. Next is a march. Bring one knee up towards your chest like you're marching. And last, you'll face the countertop again, and you're going to kick one leg to the back. And repeat on the opposite leg. And again, all strengthening exercises should be performed 1 to 2 times a day, beginning with 5 to 10 repetitions and increasing to 20 to 25 repetitions as tolerated. All exercises should be performed in a tolerable range of motion. To adjust your walker to the proper height, stand with your arms resting at your sides. The top of your walker should meet the bend in your wrist. To move from sitting to standing using your walker, you'll move forward to the edge of your seat, extending your operative leg out in front of you, and using your non-operative leg and your arms, push yourself to standing. Do not pull on your walker to stand, as it is not secure and may cause you to fall backwards. To move from standing to sitting using the walker, back up until you feel the chair against the backs of your legs. Reach back with your arms for the arms of the chair, and extending your operative leg out in front of you, lower yourself slowly to sitting. Do not pull on the walker as you sit, because it is not secure and may cause you to fall. To walk with the walker, you'll push it in front of you to a comfortable distance. Step with your surgical leg first, bearing weight through your arms to unload the leg as needed as you step the opposite leg through. As you heal and your pain levels begin to decrease, you'll begin to push the walker like a shopping cart, lengthening your strides, landing on your heel in the front and pushing off your toe in the back. To size your cane appropriately, if you already have your walker sized, you can hold the cane next to your walker and adjust the height till the two match. If you do not have a walker, if you stand with your arms hanging down at your sides, the top of your cane should meet the break in your wrist. To walk with the cane, you'll place the cane on the same side as your non-operative leg. The cane will move forward as the surgical leg moves forward, stepping through with your opposite leg. Walking upstairs with a cane. Place the cane in the hand opposite the handrail and grasp the handrail with your free hand. Begin by raising the cane and your non-operative leg up to the first step. Bring your operative leg up to meet the non-operative leg. Walking downstairs with a cane. Place the cane in the hand opposite the handrail and grasp the handrail with your free hand. Begin by advancing the cane and the operative leg to the step below. Bring your non-operative leg to the same step. An easy saying to help you with the stairs is up with the good, down with the bad. If your stairs don't have a handrail, talk to your therapist before you leave for home. They will give you one-on-one instructions. To get into bed, you'll begin seated at the edge of the bed and scoot yourself back one side at a time until the knees are supported on the bed, and then moving one leg at a time to the side. You bring yourself around to a seated position and then lie down flat. To get out of bed, you're going to push yourself up to a seated position with your arms, bringing one leg at a time around to the side, keeping the knees supported on the bed. and then scooting forward one side at a time until your feet are flat on the floor. Getting in and out of the car after a hip replacement, you'll begin by adjusting the passenger seat back as far as possible and reclined back as far as possible. Backing up to the seat until you feel that touch the back of your legs. You'll reach back with your hands to find your seat, bringing your operative leg out in front of you. You may need assistance to bring the surgical leg into the car as you lean your body backwards into the seat, bending the knee as much as needed to bring the foot into the car. To get out of the car, you'll recline your body back, bringing your leg out to the side to get your foot out of the car until you're in a seated position. To ride home, you can put the back of your seat up and be comfortable. Coming in and out of the car, you can safely bring the leg out to the side without violating your hip precautions. Getting into and out of the bathtub or shower with assistance. Reminder, do not take a tub bath, swim, or use a hot tub until your surgeon clears you to put your incision into water. Step 1, getting into the bathtub. Place the shower chair or bench in the tub if you feel it necessary, in case you fatigue and require a rest. Step 2, stand facing sideways to the tub or shower and place both hands on the open wall for safety and balance. Step 3, step into the tub with the leg nearest to the tub. To maintain hip precautions, bend the knee of the operative side towards your backside to allow adequate clearance of the leg without excessively flexing the hip and enter the tub. To accomplish this, it makes no difference whether the operative or non-operative leg enters the tub first. Have your walker readily available near the tub for proper support and safety once exiting. To exit the tub, perform the same action in reverse. Restrictive, traditional posterior hip precautions have become less strict as a result of recent technological advances and improvements in hip implant design. The following are the new hip position guidelines to adhere to during your healing phase. Please maintain these guidelines for the first 4 weeks post-operatively or follow the instructions from your individual surgeon. Avoid movements that combine bending at your waist, toeing in, and crossing the midline with the surgical leg. For example, picking up an object from the floor on the outside of the surgical leg. It is safest to turn your body to face the object and bend forward, keeping your chest between your knees. Avoid bending outside the surgical leg, as this will combine the movements of bending, toeing in, and crossing midline. When putting your shoes and socks on or taking your shoes and socks off, it is safest to reach between your legs to the inside corner of the foot. Avoid reaching to the outside corner of the foot, as this will combine the movements of bending, toeing in, and crossing midline.